Welcome to Sex Ed. Today we're going to learn about how to prevent pregnancies, because you don't want that yet. Okay, so we're going to learn about Goldie and her 3 men. Okay. One sunny afternoon, Goldie decided it would be a good idea to take a trip to the clinic and get some type of birth control. When Goldie got to the clinic, she had to fill out paperwork and then was escorted to the back room where she had to answer numerous questions about her sex life. After the awkward conversations with the physician, and Goldie started talking about different types of contraceptions, the physician told Goldie all the information about the implant and everything she needed to know. So Goldie decided it would be a good idea to go over the information she learned with her boyfriend or boyfriends. As Goldie entered her room, she was greeted by her 3 men, Bruce, Tim, and Barry. She told them of her visit to the clinic, and they of course had many questions. Barry started off the questions. What is the implant exactly? Well, Barry, said Goldie, the implanton is a flexible plastic rod the size of a matchstick that contains a progestin hormone called etonogestrel. Tim yelled, how does it even work? It prevents the egg from being released from the ovary. It changes the mucus in the cervix, which keeps the sperm from reaching the egg and also changes the lining of the uterus. Then Bruce asked, how do you insert it and where would it even go? The implanton is placed under the skin of the upper arm, and your healthcare provider will locate a groove between the bicep and tricep muscles on the inner side of your upper arm. He or she will inject a local anesthetic and use an applicator to insert the device just beneath your skin above your large blood vessels and nerves. Goldie started then telling them how effective it was. Less than 1 out of 100 women a year will become pregnant using the implant. If I were taking the other medication, it could interfere with the birth control, but keep in mind the implantant does not protect against sexually transmitted diseases. Tim then realized that he didn't even know what it looked like, so he asked. Goldie laughed because that should have been the first thing she showed them. She pulled out a picture and showed them and said the implantant is only 4 centimeters long. As Barry looked at the picture, he said, what are the side effects? Will it hurt you? Well, I could get abdominal or back pain, acne, and increased risk in non-cancerous ovarian cysts, changes in vaginal bleeding patterns, including absence of menstruation, decreased sex drive, dizziness, hair loss, mild insulin resistance, mood swings or depression, potential interaction with other medications, sore breasts, vaginal inflammation or dryness, viral infection, or weight gain. Well, what if you want to remove it? Tim asked. Well, if I wanted to get it removed, I have to visit my physician where they will inject me with an anesthetic beneath the implant. He or she will make a small incision in my skin and will push the implant toward the incision until the tip is visible and can be grasped with forceps. They will pull the implant out, close up the incision, and apply a pressure bandage, and an implantant removal typically takes 5 minutes or less. So, since you just told us how it gets removed, that means that it must have to be removed at some point. So when? Asked Bruce. The implanting can last up to 3 years, but after 3 years it needs to be removed and can be replaced with another. So when was this birth control established? Said Tim. Development and research of a single-rod subdermal contraceptive began in New York labs in 1966. So it sounds like this could be the birth control that you would like to engage in, so how much does it cost? Asked Tim. The implanting can cost from $400 to $800, and it can cost $500 to remove it without insurance. With insurance, it can be completely covered by an insurance company. My physician today told me that the implant isn't for everyone. You have to decide what's right for you. So a few short days later, Goldie decided that she should get the implant. Goldie and her 3 men entered the clinic and shortly after exited. With good thought on their minds, Goldie knew that she wasn't getting any sleep that night. The end. Yay!